Vipul and Dr. Dhruvi for inviting me as a speaker. And in the today's morning, there is so many people, so doctors are there. Today's my talk is Metabolic Mind, addressing the depression, burnout, and cognitive decline in the diabetes. So usually our CM is flooded with diabetes molecule. So this is little different topic. The word that is metabolic mind. So is it related to the brain, or it is a dysfunction or the change in the metabolic milieu? I would like to say it is an interaction between the two. The term psychological morbidity is also there, which include the depression, GAD, eating disorder, cognitive decline, and so many. So they are prevalent in the type 1 as well as the type 2 diabetes both. So how they develop in a people with a diabetes? So it is not a single factorial, but it is a multifactorial reasons that play vital role for the development of a mental disorder. For example, genetic factor, behavioral factor like inactive lifestyle, dietary habits, sleep disturbances, biological factors like inflammation, immune dysfunctions, HPA axis dysregulation. So even the psychological factor, burden of disease or the diagnosis, poor treatment adherence, medication use. Ultimately, these all factors play vital role in the type 2 diabetes patient for the development of mental disorder. So let's talk about the diabetes burnout. So it is a state of emotional, mental, and physical exhaustion experienced by the individual managing the diabetes due to the constant demand of self-care. So characterized by feeling of frustration, detachment, sense of powerlessness, leading to a decline in self-management behavior. So ultimately this patient આપણે કહીએ છીએ કે ભાઈ મેડિકેશન 3 મહિનાથી બંધ છે, બ્લડ શુગર 3 મહિનાથી ચેક નથી કર્યા. સો આવા પેશન્ટ આપણને ક્લિનિકમાં ઓપીડીમાં જોવા મળે છે. So basically some thoughts may be the play role. My diabetes is out of control, I can't be bothered, my diabetes control everything, and so on. Ultimately they create some altered feeling, either anger, overwhelmed, defeated, frustrated, worried, sad. Ultimately this patient may show the change in the behavior, like avoiding diabetes related tasks like glucose monitoring and carb counting, avoiding healthcare appointments, stopping giving insulins, doing nothing. Ultimately, this patient may develop altered glucose level. So there are the data also there that diabetes burnout, this is combination of emotion and practice ranging from tiredness to the indifference. So revealing this health condition is very vital, and it is also necessary to prevent, we can take the preventive measures. So you can see that prevalence is more than 50% type 2 diabetes patients in their lifetime experience this diabetes burnout. Second is the depression and diabetes. Again, it is a multifactorial. I can say it is a common soil pathological mechanisms that a change in the innate immunity, inflammations, HPA axis dysregulations may be because of several factors. Ultimately, there is a insulin resistance, beta cell apoptosis, hippocampal atrophy. Ultimately, this patient develop diabetes as well as cardiovascular disease. This is published in the Lancet journal, Diabetes and Endocrinology. But here they highlighted that even the depression and dementia have also the same pathological mechanism. So initially diabetic people is without depression, but may develop transient depression, then persistent. Ultimately they suffer cardiovascular disease and mortality. And it is also backed with data. For any people with diabetes, if they have depression also, then their hazard ratio is much higher than their counter colleague. So coexistence of diabetes and depression is associated with significant morbidity and mortality. Third one is the cognitive impairment. If you type the cognitive impairment and the diabetes in Google, you can see so many trials and data study. among them, recently one published in the 2025, and this says that prevalence of cognitive impairment in the person with diabetes was found to be 58%. And if the age is more than 60, duration is more than 7, then likely to have cognitive impairment. Even the one terminology, type 3 diabetes, that is related to the Alzheimer's disease. So there is a crosstalk between the differentially regulated proteins of type 2 diabetes and Alzheimer's disease. So here the poorly controlled blood sugars may increase the risk of developing Alzheimer's, and this relationship is so strong that some have called Alzheimer's a diabetes of the brain or a type 3 diabetes. So hallmark of type 3 diabetes is disturbed glucose homeostasis in the brain, disturbed cell survival, disturbed lipid metabolism, and enhanced apoptosis. So this cognitive impaired patient may suffer routine activities in their day-to-day. For example, in case of diabetes, it is a glycemic monitoring. So patient cannot remember how to perform a finger stick, cannot remember at what time blood sugar glucose test should be done, unable to recognize communicate hypoglycemia or sign of hyperglycemia, and so on. Second part is nutrition. So these people may have an unpredictable eating, resulting in the wide glycemic excursion, either hypoglycemia or hyperglycemia. And also the physical activity. In these people, usually they may have a problem also, like they may have obesity, osteoarthritis, even sleep apnea, and some they cannot remember how to return home after the taking walk, cannot remember how to prevent or treat hypoglycemia when active, forgets to carry carbohydrate during the physical activity, and so on. Medication management, even they may miss the medication or may sometimes take or duplicate the medication. Personal hygiene is also be the one of the role that is suffering in this group of patient. Cannot remember to bathe, resulting in the increased risk of the skin breakdown or infections. And very important thing is if patient is type 2 diabetes, and also have a psychological comorbidities like diabetes distress, depression, or cognitive impairment. Data says that there will be the more likely to have hyperglycemia, increased HbA1c. Ultimately, these people may end up in the microvascular as well as the macrovascular complication, and ultimately they may have a decreased quality of life as well as the increased mortality. And same trend is with type 1 diabetes also. Ultimately, type 2 diabetes patient, once develop the cognitive impairment, may end up the true destiny, that is the death. So what to do next? So it is very important to take into the mind that only one person cannot manage the whole aspect of the diabetes. So we should take a help of other people also, and team-based approach is very, very well expected. So for example, for better mental health, we have a behavioral or mental health provider like psychologist, psychiatrist, clinical social worker, or certified counselor. So whenever patient first time detected a diabetes, or may at any phase of living with diabetes, we may ask for the help of our mental health provider. Because at any moment, if patient have symptoms of psychological illness that is not carry or very well handled with the physicians, then it is better to take help of our colleague. So when we should make the referral? So positive screen on validated screening tool for the depressive symptoms, diabetes distress, anxiety, fear of hypoglycemia, or suicidal thoughts, presence of symptoms of suspicious or disorder, eating behavior, intentional omission or underdosing of insulin, serious mental illness, in youth and family with behavioral self-care difficulties, repeated hospitalization for the decay, low engagement in the diabetes self-management behavior before undergoing the metabolic surgery or even after surgery. So there are the 10 tips given by the CDC. And this is general for all group of patients. So pay attention to your feeling. Pay attention to your feeling. So almost everyone feels frustrated or stressed from the time to time. Dealing with diabetes can add to this feeling and make you feel overwhelmed. Having this feeling for more than a week or two may signal that you need help so that you can feel better. Second, talk with your healthcare team about your feeling. Let your doctor, nurse, diabetes educator, psychologist, or social worker know how you have been feeling, and they can help you problem solve your concerns about the diabetes. Talk to your healthcare team about the negative reactions other people may have about your diabetes. Ask if help is available for the cost of diabetes medicines and supplies. Talk with your family and friends. So tell those closest to you how you feel about the having diabetes. Be honest about the problem you are having in dealing with diabetes. Allow loved ones to help you take care of for your diabetes. And talk to other people with diabetes. Tell they will understand the some of the things you are going through. Do one thing at a time. When you think about the everything you need to do, manage your diabetes, it can be overwhelming. Pace yourself as you work on your goals, like increasing physical activity, take it slowly. Take time to do things you enjoy. So give yourself a break, set aside time in your day to do something you feel really loved one. So this is also the very well, so it is also said by Dr. V. Mohan about the diabetes burnout. Take small steps and take inspiration from others. Be specific about the problem. Do not ignore it. Celebrate your achievements, even the smallest ones. Connect with other families who live with diabetes, and this can provide incredible support. For psychosocial care, again the ADA recommending that psychosocial care should be provided to all people with diabetes with a goal of optimizing health-related quality of life and health outcomes. Implement screening protocol for psychosocial concerns, including the diabetes distress, depression, anxiety. When indicated, referral should be there. For example, patient may have a major depression, suicidal tendency, anxiety, treatment-related fear of hypoglycemia. We can take a help of a mental health provider. And consider developmental factors and use age-appropriate validated tools. So time is over. So I am concluding my talk. Similarly, in case of depression, if symptoms are there, we can take help of our psychiatrist colleague also. Symptoms of cognitive impairment, we can take help of our neurophysicians as well as the physiotherapist. Similarly, this all means role of healthcare professionals in supporting the need of people with diabetes and cognitive impairment. So it is a team-based management. Family, friend, caregivers, home care service, case management, hospital, even the hospital can offer the palliative care. So assisted device for the people with diabetes, recording and alarming devices are there. We can take help of this. And lastly, the newer technology like picture phones, electrical use monitor, talking glucose meter, CGM devices, we can take help of this all type of electric gadgets. So by this way, we can support our people who have mental illnesses. Thank you.
Thank you so much.